Hi guys, good afternoon. This is Dr. Bhupesh, your OET mentor from Dr. BKM Institutes, and today we will discuss about the writing. We discuss a lot of things about reading and listening in this session. Today we are thinking about covering a bit of writings, and I will try to simplify it as much as I can for you. So please pay attention, pay heed to it, because I will try to cover all the points, whether it would be a visit letter, it would be a discharge plan letter, it would be a referral letter. First of all, we people get confused so much in these kind of letter, whether this is a referral letter, oh my god, this is a discharge plan letter. Please understand, it is just a simple patient that needs to be forwarded to a specific person. Like in this case, we have to write a letter to Salisbury Council Community Health Nurse. So the only word that should come in my mind is that I have to write a letter to a community nurse, community health nurse. Her name is Mrs. Flinda Faye, Salisbury Council, Main North Street. So the only thing that should stay in my mind is community health nurse. So I have to write a letter to a community health nurse. Now, community health nurse cannot change medications, cannot prescribe medications because she is a nurse, but she can provide the exact dosage of the medications prescribed by the doctor. Community nurse can help the patient to encourage for various things like diet, like therapies, to quit smoking, to decrease drinking, if she has to inform anything to the school. So all these points becomes essential. When I see to this letter, then this community nurse has to do this thing. So when in OET letters are like this. Okay, let me take it this way. So letter is like this. So you get almost like 2 pages of the letter. This is like the complete page of this letter. So I want to show you the complete letter. So OET letter is divided into talking about the patient, when he was admitted, when he was discharged. So most of the time when you are writing a letter to community nurse, that means it is a follow-up care. Community nurses are present in the community. They are not in the hospital. They are in the community to provide the follow-up services. So the patient was admitted on 18th. After 5 days, he got discharged. He was positively tested for toxoplasmosis. So that was the condition. That was the disease he came up with. Then social background of the patient was that she was single, 16 years old, because her name is Jade Harley. So she is a girl, single, unstable home life since birth, 16 years, victim of child abuse, criminal record for theft. That means her childhood has not been very great, and left school at 16 to have the first baby. So at the age of 16, she had the first baby. She dropped the school, did not resume studies. On 2 occasions, older children were taken away, February 2003 and 2004. Right is 2008. So 5 years back and almost 4 years back. 2008 minus 2004. That means 4 years back and 5 years back, both the children were taken away by the government. In foreign countries, what happen, if you are unable to take care of the children, government takes them away because you are not taking care of the children. It is not like other countries that we are responsible, we are parents. So if you are not a good parent, they will take away the children. So that is what is the reason for this. And the reason was home was dirty, children were neglected. So she was not paying attention to children, her home was dirty, and she was victim of child abuse. And she was heroin addict. She was heroin addict, but is this given with a question mark? Question mark means it is not sure that whether she is heroin addict or not. So in the past she was heroin addict, but in the present we are not sure. So most probably she is doing even now. Is and question mark means that we are not sure about the present, but in the past she was heroin addict. Has boyfriend currently, boyfriend is also unemployed, not father of other two children. So the current boyfriend is not the father of other two children. So we are just trying to collect the history for the community health nurse, that what this girl is all about. Then boyfriend, a known heroin addict. He is also a heroin addict, currently on parenting payment, has never worked. Patient has no family to assist her, so she lives alone. Lives in a housing trust flat with numerous cats. In OET, otherwise, most of the letters are very simple. In this letter, it is a bit tricky, but this kind of a letter will not come that will use your medical knowledge. But yes, this letter is talking about that child are the victim of child abuse, or sorry, toxoplasmosis. The patient is of toxoplasmosis, and toxoplasmosis majorly spreads through cats. But so we will include this data. Otherwise, in normal letters, if you do not know it, you will ignore it. but this letter contains this numerous cats. So that is because of the cats and dirty home that she is having toxoplasmosis. Patient is a heavy smoker and she is a heroin addict as well. She was, and current boyfriend is a heroin addict. So basically the life is not really up to the mark as compared to, the normal average life. Then nursing management is and progress means that during hospitalization, 5 days, 5 days, 23 minus 18, almost 5 to 6 days. So 5 days, what happened? She was aggressive. She was so the nursing management and progress or the during hospitalization always comes in the past. Past means the patient, you will write patient was aggressive, patient was uncooperative. So, and you use a connector. So the private room was provided. Patient was unable to sleep due to drug dependency. Patient fell from the bed and broke her collarbone. So now I need to understand what do I want to write to community health nurse. So I will tell community health nurse that this patient can be aggressive, this patient can be uncooperative, because during hospitalization we have seen that she did not sleep well, she broke her collarbone. Patient was washed, so the wound was washed. Patient is given wrong here. Wound was washed, disinfected. Infected puncture wounds in the arms, hands were cleaned, healing. Patient was emaciated, so was put on high protein diet. Emaciated means she was too thin, she was not eating food, so she was put on high protein diet. Burn marks noticed on the arms, also victim of abuse. So she has been a victim of abuse in the past, which we already know that she was victim of child abuse, and burn marks noticed on the arms as well. Patient complained of frequent headaches for which Panadol Forte was given. She was aggressive, so Valium was prescribed to calm the patient. Valium to prescribe to this, and toxoprime prescribed 4 times in a day with the meals for toxoplasmosis. That is the main condition we are talking about, toxoplasmosis. So now I will tell you how to arrange the letter. It will not take even a second. You will see that OET letters are like this, and we will go with the flow. Now this is the main point of the letter. That is what we all need to understand. What is the purpose of the letter? This, my dear, in the last discharge plan is the purpose of the letter. So each and every letter is decided by this information. This is the main information. When it comes to visit letter, last visit is the main reason. That is the purpose. What the patient is having in the last visit, because last visited to today's visit. Today's visit means that today the patient is having this problem. That is why we are referring the patient. In the discharge plan letters, this becomes the main thing, that what is the discharge plan, because we tell the community nurse to follow the discharge plan. So let's see what community nurse has to do. She will make a contact with the social worker to arrange home visit for the assessment of hygiene standards in the home, possibly arrange domiciliary care. So this is the main point of this letter, because toxoplasmosis happens due to dirty home, numerous cats. So the first thing is to arrange a social worker. So this is a very important point of this letter. Arrange follow-up visit with the GP for the collarbone fracture that happened during the hospitalization, so that community nurse can do. Patient to be sent to Royal Outpatient Methadone Clinic for the initial appointment. This you can miss out, not a problem. You can easily miss out this point, doesn't talk about anything. Department of Education and Children's Services to be contacted for the assessment of children's safety. So this is an important point, that she is having 2 kids which were removed in the past. So that means she is unable to take care of the kids. So it is very important that you guys arrange Department of Education and Children's Services so that the children's safety can be maintained. Psychologist to be contacted because she is not psychologically well. High protein diet to be followed by the community nurse. So this becomes very important point, as it specifically mentions about community nurse. This is also very important. Burn marks and puncture wounds to be dressed and surveyed. So these are important points. So that is coming up. So our letter is almost over. And then arrange visit by the quit line for the assistance to quit smoking, because she's a smoker as well. Contact principal of the school to explain the family and get report on Brady's progress. This is not very important. Service patient compliance with the medication for toxoplasmosis. So the main problem is toxoplasmosis. So that becomes a very important information. Now you will see the overall letter and try to write the purpose. Let's see what is the purpose of this letter. This letter is being written regarding this girl, Miss Harley, MS Harley, because we don't know whether she is married or not. So MS Harley, who was diagnosed with toxoplasmosis, yeah, who was admitted to our hospital due to toxoplasmosis. After treatment, she is better. Is she better? That doesn't really say whether she is better or not. So we can't really claim that. Otherwise, in the normal letters, you will find that she is generally better or not. But in this letter, there is nothing that says that she is better or not. So we will say that after treatment, obviously there should have been a line that she is better. So she is being discharged. Now she needs follow-up care, hence is being referred to you. So I will write the first basically paragraph for you and will tell you how to write the purpose. Let's take it easy and in a very swift and easy way. And you will see once you know the OET letter, it doesn't take even 5 minutes to complete, 15 minutes to complete the letter. So I'm just going to write by paragraph. So all of you who are new to this will be able to understand how easy OET is. This letter is being written regarding Mrs. Harley. And please note all the commas. I will try to write with all the punctuations. H should be capital. I will tell you everything about the grammar in this letter. I will tell you everything about punctuations. So this letter is being written. R should be smaller. Mrs. Harley, M and H. Patient's capital name, a patient's second name, and Mrs. Harley, M should be capital. So this patient is not married. So I would say Miss Harley. MS Harley, who was admitted. This is a passive voice. Who was admitted by someone or by us. So was plus third form is a passive voice. Who was admitted to our hospital due to toxoplasmosis after required treatment. So it is not given, but in normal letters it would be given that her condition has improved or not after required treatment, but it is not given, then I will not read. After required treatment, she is being discharged. However, so sorry, now she needs follow-up care. So these are the commas. After required treatment, comma, she is being discharged. Normally in the letter, this would be given that she is better after treatment. So I would say after treatment, she is better. Then connectors will become better. She is better. Sorry, she is better. So she is being discharged. So when I write so, that means that after treatment, she is better. So she is being discharged. Therefore, she is being discharged. So with comma, you can use so. So if I say she is better, so she is being discharged. Now she needs follow-up care. For herself and her children. Therefore, she is being referred to you. Simple. So that is what OET is all about. But in this letter, domiciliary care is also a very important thing. So she needs follow-up care for herself and her children, and also she needs help to maintain or to keep her house, her home clean and hygienic. So this is an additional point I am adding. If you do not add, again, OET does not deduct in marks because in the last paragraph it will come. But when I know exactly about the letter, then I would definitely like to mention this point that who was admitted due to this. After required treatment, she is better. She needs follow-up care for herself, and also she needs help to keep her house clean. Help to keep her house clean and hygienic. Therefore, that is the first paragraph. That's how simple it is. You find the basic purpose of the letter, you just write it, and then it's all done. The second paragraph is all about social history and medical history. So now you can say Miss Harley is a smoker and was a drug addict, and maybe she is addict even now. Or you can say, and her current status is unknown. If you want to write in your own language, that becomes even better. That she was a smoker and was a drug addict. Her current status is unknown. So that becomes even better when you write in your own language and make it easy. She has two children who were taken away on couple of occasions due to her dirty house as they were neglected. So I'm just writing haywire, means I am just writing very easily due to her dirty home, and also they were neglected. So the last paragraph, discharge pen paragraph, does not talk about her boyfriend. So I don't have to mention it to save my data. So that is how you save data. She is heavy smoker and also has numerous cats in her home. So that is, I think, have covered everything about this letter. Let me check if I have missed out on any point. So I've covered all these things. Single, unstable home lives in birth, victim of child abuse, criminal record for theft, couple of occasions, children her is heroin addict, parenting payment has never worked, no family to assist her. So that is one of the point I would like to say, is single and has no family to assist her. She's a smoker. So that is how simple it is. You just have to, that is how simple it is. Just write it the way it comes your way. Take it easy, take it nicely. And that is why I say, oh, it is the easiest test of the world. Then you write about the third paragraph during hospitalization. During hospitalization, she was unaggressive and uncooperative. That is where I use connectors, uncooperative. So a private room was provided. She fell down, and simple, I'm just writing things. That aggressive, she was unable to sleep due to drug dependency. Again, there is, she was unable to sleep due to drug dependency and fell down, leading to fracture. Fracture leading to collarbone fracture. Leading to collarbone fracture. Connectors, again, connectors. For that, bandage was applied. So you write only the main points in the easiest of way. Don't worry about what you are missing, because you are going to get marks for what you are writing. Now the main things, patient was emaciated, so she was put on high protein diet. So I just have to tell the community nurse. So I don't have to explain everything to community nurse. So 1 marks for notice on arms, that I wrote. Patient was emaciated, so high protein diet was. She was emaciated. By chance I write the patient over here. It does not look nice. All of a sudden she became. If you want to use the patient, you should write here in the first thing. During hospital, then you should use she only. Don't use in middle at all of a sudden the patient. So because you should use the patient over here, Miss Harley over here. So that is how you should be planned, that if you want to use the patient, it should come over here rather than being in the middle, looks haywire, and all of a sudden it comes up. So emaciated, for which, this is another connector that I wanted to teach you with commas, for which protein diet was encouraged. That is how easy you can go about your writing. And now the main thing about toxoplasmosis, medications, and aggression. Medication. Now you can shuffle the sentence, but again and again saying she was emaciated, she was. So try to change. Like over here, I changed that, for that bandage was applied. So I changed my subject and made it a passive voice like this. All are passive voice, was admitted. In the same way, if I talk about this was provided by us, so private room was provided. That means by us. It's a passive voice. Bandage was applied by us. It's a passive voice. Uh, Protein diet was encouraged by us. It's a passive voice. Medication was prescribed for her aggression and toxoplasmosis. So that is where I have completed almost 3 sentences with this simple thing. If you want to write medications alone, then you can say Valium. You don't have to describe too much of dose to community health nurse, because she will give the dose according to what? So इसे prescribe word aggression and toxoprime for toxoplasmosis. So you can also say Valium for her aggression and toxoprime for toxoplasmosis were prescribed. So now this needs to. So you can shuffle the sentences according to your comfort and your convenience. So now this paragraph is also over. Even if I missed one or two lines like headache, I don't feel that is too important. So you can miss it. Now the discharge plan, the most important paragraph where you're going to get the marks. So now the last paragraph. Always start with it would be greatly appreciated. So two important points. Toxoplasmosis medication that was given patient compliance with medication, and the important point was home. So these 2 points I would like to write upfront. It would be greatly appreciated. And also, how do you get more marks? Now this is the thing to understand. How do you get more marks? When you write this toxoprime medication, and then immediately in the next paragraph you talk about the same thing. So you are making it cohesive. So it would be greatly appreciated. Always start discharge plan letters like this. If you could continue, or if you could monitor her compliance with her with her medications. So you don't have to write toxoplasmosis because you have just written about this. And also arrange a social worker. Arrange word is a very important word when you are arranging some other person. Arrange a social worker for her home help. Home help, possibly arrange domiciliary care. Home help, possibly domiciliary care. So now I have covered all my important points. Rest is all about writing, just that parents should her school should be informed, and this domiciliary spelling DOMICILIARY. Yeah. So there is nothing. Then second sentence, now passive voices. First sentence is it would be greatly appreciated if you could. That is the first sentence you make. Then you make passive voices. Arrange follow-up appointment with local GP. So should be plus third form is the passive voice. So appointment with local GP, name, appointment with local GP should be arranged. So that is how simple it is. Now it would be like, that's it. Then patient to be this, I don't know. Department of Education Services to be contacted for assessment of children's safety. And Department of this and this needs to be contacted. Just shuffling should be in place of should be. To change it, I am writing should be arranged is a passive voice, needs to be contacted again is a passive voice. It's just I am making a change to it. That is the only thing I'm doing. I'm just changing should be plus third form into needs to be contacted for children's safety. Rest all is same. That is how simple you can make your OET letters. Then psychologist to be contacted for assessment. High protein diet should be followed by the community nurse. So if I write here for which high protein diet should be continued, should be continued. So continued word means that over here it was encouraged or it was started. So high protein diet should be continued. Puncture wounds I didn't write, so I won't write it. And quit line for assisting quitting smoking. Okay. Continued. And quit line smoking, what was the thing? Quit line. Arrange visit by the quit line. So I will write the same line and arrange visit by the quit line because it is already a very simple and nice sentence. Visit by the quit line for quitting smoking. As well. As well means I'm ending the letter. Now read it. High protein diet should be continued and arrange visit by the quit line for quitting smoking as well. That's your letter, and it does not take even 15-20 minutes. Should you require further information, feel free to contact. So I missed a couple of points, that's okay, but this is my simple letter and it's all ready to go and to fetch me more than 350 marks. I need only C plus, this will fetch me B, and these are the words which would be counted. That's it. These are the words, this line will not be counted should you require further information. So this is the only thing that would be counted. That's pretty much it. This is simple letter. And how to write starting and ending for the new students. So I'm writing to community Salisbury Council Community Health Nurse, Mrs. Linda Fay. So I'm just telling you the pattern for the new student, Mrs. Linda Fay. Yeah, Fahe. F should be capital. You have to take care of this. No comma, nothing. Community health nurse. H should be capital, obviously. Then you go to the next time. It says Salisbury Council. So you write the same thing. Salisbury Council, complete. I'm just doing for myself for convenience. 667 Main North Road. 667, comma, Main North Road. R should be capital. Then you go to this place, Salisbury 5067. So Salisbury 5067. That's my address. And then you write today's date. Today's date was 23rd because the patient was discharged 3/23/5/08. Is a single mother has been kept in 3 where she was tested. So 23/5. So I always take the last thing. 23 May, April, May 2008. And then dear MS Wahe. And regarding this patient name is MSZ Harley. That is your complete letter. H capital. Age is very important, so please write the age as well. H should be capital. I don't know what's wrong. Okay, yeah, pretty much all right now. Harley, comma, aged. Let's see what her age. 22. And A should be smaller. By chance it went into capital somehow by itself. Age 22. So that's my letter. One line space starting from the left. One line space starting from the left. One line space starting from the left. One line space, not two line. One line space starting one line space. This says yours sincerely. And I'm writing sincerely just because this name is given. Mrs. This Linda Fay name is given. So then I write yours sincerely. Otherwise, I will write yours faithfully if the name is not given. So yours sincerely. And let's see if my name is given as a registered nurse. Otherwise, is my name given? No, I'm not registered nurse. I'm just given, that's it. So I'm a registered nurse. That's it. So that's my last thing. Registered nurse. Comma, registered nurse. If my name would have been given, I would have written it over here, giving a space. So yours sincerely, registered nurse. That's my complete OET letter. This is how an OET letter looks like. Oh, sounds so good. So that is how simple OET is. Sometimes looks complicated, but it is not at all. And writing, as I have always told you, is the easiest of the things to be covered. Controlling word count is not difficult when you are not writing anything extra. Just anything you feel clumsy, don't write it. Make it easy. And this is Dr. Bhupesh from Dr. BKM Institute telling you again that OET can be the easiest of the things to be conquered and to become invincible, as we discussed in that motivational video. Thank you.